Food is an essential part of our daily routine, but it can be difficult to follow the right diet or advice. This short video aims to explain some of the common myths and help you understand more about how food interacts with digestive health. There is a difference between food allergy and food intolerance. An allergy is an abnormal immune response leading to an itchy rash, soft tissue swelling, abdominal pain, and diarrhea, difficulty breathing, and can be life-threatening in some circumstances. The offending substance is called an allergen, and it is not fully understood why some people develop an allergic response to a substance which in majority of other people is completely harmless. Common dietary allergens include eggs, peanuts, and shellfish. A unique, albeit common food allergy, which is often confused with an intolerance, is gluten enteropathy, also known as celiac disease. Gluten is found in wheat and grain products such as bread, cereal, pizza, pasta, pastry, and beer. Celiac disease is diagnosed by measuring antibodies in blood or intestinal biopsies during a gastroscopy procedure. Intolerance is where certain food items cause unwanted symptoms or side effects, but there is no underlying immune response. Instead, these symptoms or side effects are due to normal variation in digestive enzymes, acid levels, bowel movement time, and volume of other solids or liquids consumed. For example, some people, despite not having celiac disease, still cannot eat large amounts of grain without feeling bloated or flatulent. This is normal. Digesting grains release a gas called carbon dioxide, and some grains release more compared to others. How much carbon dioxide each individual person can tolerate without feeling bloated or flatulent will vary. This is individual intolerance, and not an allergy to gluten. Another good example of this is dairy products and diarrhea. Some people can have lots of dairy in their diet, whereas others cannot. This is not an allergy. This is due to each person having a different level of the digestive enzyme, lactase, which helps to digest dairy. In other words, everyone would eventually develop diarrhea if they consumed more dairy than their body can digest. Fruit and vegetables are rich in nutrients and full of fiber, both of which are needed for good digestive health. In addition, other medical conditions such as type 2 diabetes, ischemic heart disease, and obesity are improved by adhering to a diet containing at least 5 different fruit and vegetables per day. However, some fruit and vegetables contain complex starches and sugars, which are more difficult to digest and can result in excessive bloating, flatulence, early fullness, and abdominal discomfort. These complex starches and sugars are known as FODMAP. These foods are not dangerous or unhealthy, but may cause unwanted symptoms if consumed in large quantities or too regularly. Commonly eaten foods containing FODMAP include apples, mango, soft cheese, artificial sweeteners, cabbage, garlic, onion, beans, mushroom, and chickpeas. You may be asked to monitor your diet using a FODMAP diet sheet, and if it becomes obvious that a high FODMAP food is in your diet regularly, you may benefit from omitting that single item. You do not need to avoid all high FODMAP food groups, and any dietary modification is best done with the guidance of a dietitian, GP, or gastroenterologist. Heartburn or indigestion is a common reason for consulting a gastroenterologist. However, more often than not, the cause of heartburn can be attributed to lifestyle behaviors, most importantly, our diet. There are several factors that influence heartburn, but 4 relate to diet and can be modified to prevent symptoms. 1. Acid content of food. 2. Fat content of food. 3. Portion size. 4. Timing of each meal. Large portion sizes, full of rich, fatty food groups, will take longer to digest, and therefore, the stomach will produce more acid. The more acid that is present in the stomach, the more likely it will come into contact with the gullet, triggering pain and heartburn symptoms. Food groups containing high amounts of fat include processed meats, butter, cream, and cheese, cakes and chocolates, coconut oil, fried food, and lamb, pork belly, and ribeye steak. Acid food groups include fizzy drinks, coffee, alcohol, citrus fruits, tomatoes, garlic, and onions. These foods are not dangerous or necessarily unhealthy if consumed in moderation, but may cause unwanted symptoms or side effects, similar to FODMAP discussed earlier. Antacid tablets are available to treat the symptoms of heartburn, but altering your diet and behavior can have a similar positive effect. Focus on smaller portion sizes, a diet containing less fatty or acidic food, and not eating late at night shortly before laying down. If you have any concerns about your symptoms, it is important you discuss this with your GP or gastroenterologist.